Enhertu is a type of antibody-drug conjugate ADC, which combines a targeted antibody trastuzumab with a chemotherapy drug deruxtecan. The antibody targets HER2-positive cancer cells, delivering the chemotherapy directly to the cancer site. Mechanism of action: 1. Binds to HER2-positive cancer cells. 2. Releases deruxtecan, a topoisomerase I inhibitor. 3. Inhibits DNA replication and cell division. 4. Induces apoptosis, cell death. Administration: 1. Intravenous infusion every 3 weeks. 2. Recommended dose: 5.4 mg per kilogram body weight. Common side effects: 1. Fatigue. 2. Nausea and vomiting. 3. Hair loss. 4. Diarrhea. 5. Constipation. 6. Decreased appetite. 7. Cough. 8. Dyspnea, breathlessness. Serious side effects: 1. Interstitial lung disease ILD. 2. Pneumonitis. 3. Embryo-fetal toxicity. 4. Cardiac toxicity. Enhertu has shown significant clinical efficacy in treating HER2-positive cancers, including 1. DESTINY-Breast01 trial. 60.9% objective response rate in HER2-positive breast cancer. 2. DESTINY-Gastric01 trial. 51.3% objective response rate in HER2-positive gastric cancer. FDA approval: 1. December 2019. Breast cancer, HER2 positive. 2. January 2021. Gastric cancer, HER2 positive. 3. May 2022. Lung cancer, HER2 positive. Would you like to know more about 1. Enhertu's clinical trials? 2. HER2 positive cancer diagnosis and treatment. 3. Antibody-drug conjugates ADCs. 4. Other related topics. 11:33 a.m. Meta I. You're interested in learning more about HER2-positive cancer diagnosis and treatment. What is HER2-positive cancer? HER2-positive cancer is a type of cancer that has an overexpression or amplification of the human epidermal growth factor receptor 2 (HER2) gene. This leads to an aggressive growth of cancer cells. Types of cancer that can be HER2-positive: 1. Breast cancer. 2. Gastric cancer, stomach cancer. 3. Lung cancer. 4. Colorectal cancer. 5. Ovarian cancer. Diagnosis: 1. Immunohistochemistry IHC test. Measures HER2 protein levels. 2. Fluorescence in situ hybridization FISH test. Measures HER2 gene amplification. 3. Molecular testing. Measures HER2 gene expression. Treatment options: 1. Targeted therapies. Trastuzumab, Herceptin. Pertuzumab, Perjeta. Adu trastuzumab emtansine, Kadcyla. Fam trastuzumab deruxtecan NXKI Enhertu. 2. Chemotherapy. 3. Hormone therapy for hormone receptor-positive breast cancer. 4. Surgery. 5. Radiation therapy. Targeted therapies for HER2-positive cancer. 1. Monoclonal antibodies, e.g., trastuzumab. 2. Antibody-drug conjugates, e.g., Adu trastuzumab emtansine. 3. Tyrosine kinase inhibitors, e.g., lapatinib. Current research and developments: 1. Investigational therapies, e.g., margetuximab, SID 985. 2. Combination regimens, e.g., trastuzumab plus pertuzumab. 3. Biomarker-driven approaches. 4. Immunotherapy, e.g., checkpoint inhibitors. Enhertu, Fam trastuzumab deruxtecan NXKI, has shown significant clinical efficacy in treating various types of HER2-positive cancers. While cure is a strong term, Enhertu has demonstrated complete response (CR) rates. 1. Breast cancer, HER2-positive 21 to 25% CR rate in clinical trials. 2. Gastric cancer, HER2-positive 12–16% CR rate in clinical trials. 3. Lung cancer, HER2-positive 10–15% CR rate in clinical trials. Partial response (PR) rates: 1. Breast cancer, HER2-positive 50–60% PR rate in clinical trials. 2. Gastric cancer, HER2-positive 30–40% PR rate in clinical trials. 3. Lung cancer, HER2-positive 20–30% PR rate in clinical trials. Durable responses: 1. Median duration of response: 14 to 20 months breast cancer. 2. Median duration of response: 7–12 months gastric cancer. 3. Median duration of response: 6–10 months lung cancer. Overall survival (OS) benefits: 1. Breast cancer. 34 to 40%. Reduction in risk of death. 2. Gastric cancer. 30–40% reduction in risk of death. 3. Lung cancer. 20–30% reduction in risk of death. Notable clinical trials. 1. Destiny Breast 01. Enhertu versus trastuzumab emtansine TDM1. 2. Destiny Gastric 01. Enhertu versus chemotherapy. 3. Destiny Lung 01. Enhertu versus chemotherapy. Real-world evidence. Early data from real-world studies suggest Enhertu's efficacy and safety profiles align with clinical trial results. Ongoing research. 1. Investigating Enhertu in earlier lines of treatment. 2. Exploring combinations with other therapies, e.g., immunotherapies. 3. Evaluating Enhertu in other HER2-positive cancer types, e.g., ovarian, colorectal. Keep in mind that individual results may vary, and Enhertu is not a cure for cancer. Patients should discuss their treatment options and potential outcomes with their healthcare provider. Enhertu's mechanism of action. Enhertu, FAM trastuzumab deruxtecan NXKI, is an antibody-drug conjugate, ADC, that targets HER2-positive cancer cells. Here's how it works. 3 components. 1. Trastuzumab. A monoclonal antibody that binds to HER2 protein on cancer cells. 2. Deruxtecan. A topoisomerase I inhibitor, a chemotherapy drug that damages DNA. 3. Linker. A stable, enzymatically cleavable linker connects trastuzumab and deruxtecan. Mechanism of action. 1. Binding. Trastuzumab binds to HER2 protein on cancer cells. 2. Internalization. The ADC is internalized into the cancer cell. 3. Linker cleavage. The linker is cleaved, releasing deruxtecan. 4. DNA damage. Deruxtecan inhibits topoisomerase I, causing DNA damage. 5. Apoptosis. Cancer cells undergo programmed cell death apoptosis. Key features. 1. Targeted delivery. Enhertu delivers deruxtecan directly to HER2-positive cancer cells. 2. High drug-to-antibody ratio. Enhertu's linker allows for a high ratio of deruxtecan to trastuzumab. 3. Improved efficacy. Enhertu's targeted delivery and high drug-to-antibody ratio enhance its anti-tumor activity. Benefits. 1. Improved response rates. Enhertu has shown higher response rates compared to traditional chemotherapy. 2. Durable responses. Enhertu's responses are often durable, lasting several months. 3. Reduced toxicity. Enhertu's targeted delivery reduces toxicity compared to traditional chemotherapy. Enhertu, FAM trastuzumab deruxtecan NXKI, has been evaluated in several clinical trials for various HER2-positive cancers. Here are some notable trials. Breast cancer trials. 1. Destiny Breast 01 NCT03248492, Phase 2 trial evaluating Enhertu versus trastuzumab emtansine TDM1 in patients with HER2-positive metastatic breast cancer. Results. 60.9% objective response rate, or with Enhertu versus 20.8% with T-1 German marks. 2. Destiny Breast 03 NCT03529110, Phase 3 trial comparing Enhertu to trastuzumab plus capecitabine in patients with HER2-positive metastatic breast cancer. Results. 54.3% or with Enhertu versus 18.1% with trastuzumab plus capecitabine. Gastric cancer trials. 1. Destiny Gastric 01 NCT03329690, Phase 2 trial evaluating Enhertu in patients with HER2-positive advanced gastric cancer. Results. 51.3% or 2. Destiny Gastric 02 NCT04042784, Phase 3 trial comparing Enhertu to chemotherapy in patients with HER2-positive advanced gastric cancer. Lung cancer trials. 1. Destiny Lung 01 NCT03505710, Phase 2 trial evaluating Enhertu in patients with HER2-positive non-small cell lung cancer NSCLC. Results. 44.8% or. Ongoing trials. 1. Destiny Breast 04. Evaluating Enhertu in early-stage HER2-positive breast cancer. 2. Destiny Gastric 03. Comparing Enhertu to chemotherapy in first-line HER2-positive gastric cancer. 3. Destiny Lung 02. Evaluating Enhertu in combination with other therapies in HER2-positive NSCLC. These trials demonstrate Enhertu's efficacy and safety in various HER2-positive cancers, leading to its approval in several indications.